My name is Nishia Mehta, and I'm a research student here at Women's College Hospital working with Dr. Roshan in the Aging Research Group. So I first became interested in aging during my time as an undergraduate at York University, where I learned in my global health courses about how the world's demographics were rapidly changing, and that, in a couple years, the majority of people who live even around the world will be of either middle age or will be of an advanced age. I know right here in Ontario, by 2036, the projection is that every 1 in 4 people will be an older adult. And as someone going into the healthcare industry, I wanted to be able to meet the needs of this changing demographic and learn about how I could do that. So the project I'm working on right now under Dr. Roshan has to do with how technology is used by people who suffer from dementia or who care for someone who is living with dementia. And so the project specifically I presented at eHealth 2018, which is a conference all about health technology and informatics. And the project itself is looking at social media, so specifically Twitter and online health forums, to see how people with dementia and their caregivers use these social media sources. So I'm interested in learning about what they're posting about, who is posting, is it majority women, for example, that post as caregivers, and then from that information, learning about how can we better meet their needs at a policy level, a clinical practice level, and at a medical education level. So that's our project in a nutshell. However, what I'm interested in is when patients go online and post about their own medications and their own experiences, what can we learn from that to further our understanding about good prescribing and the experience of being on medication therapies? So that is why I'm interested in using social media. I think the implications for this work are quite large in that, first of all, it takes the patient's voice as being the central element in health research, which is a trend that the larger health research industry is moving towards. And second of all, it allows us to use your data to really learn how to better meet your needs. So for example, if we learned that the majority of caregivers were women and that we also knew that they experienced loneliness and distress, then we can orient our services to be able to provide them with better mental health supports, for example. So the next steps for this project include taking it to the publication level and being able to share this knowledge more widely with the research community. And I hope, as someone who is now entering medical school, I'm going to take these research findings and really implement them into my own practice and into my peers' practice. Overall, I hope to become a clinician scientist, and I hope to continue doing patient-oriented research looking at technology specifically.